joining us this morning to make your health a priority and schedule your mammogram today, we have Dr. Carolyn Daly with us today. How are you doing today, Dr. Carolyn Daly?
I am wonderful. Thank you.
You're going to chat with us today about the importance of getting those mammograms scheduled right now. And you're a radiologist who specializes in breast health at Bronson and board certified in diagnostic radiology. You received your medical degree from Emory University in Atlanta, Georgia, and completed your fellowship in women's imaging and residency at the University of Michigan Health System in Ann Arbor. And you're a member of the Society of Breast Imaging, sits on the Patient Care and Delivery Committee. A little background on you, just so everybody knows why we've got you on here today. So what is a mammogram?
So a mammogram is an X-ray test of the breast where we are looking for breast cancer. It is a non-invasive and low-dose X-ray, and it is the only test that's been shown to reduce breast cancer death. Mammograms can detect cancer early, long before it can be felt by you or your doctor. And unlike X-rays of other body parts, it requires gentle compression of the breast. This allows us to obtain images with fantastic detail and less radiation.
So why are getting mammogram screenings important?
Well, studies from multiple countries have proven that annual mammograms decrease your chance of dying from breast cancer. Now, this next fact may be surprising to many listeners. About 3/4 of women diagnosed with breast cancer in the U.S. have no family history of the disease and are actually not considered to be high risk. In most cases, breast cancer can be cured when found early with screening mammograms, thanks to great treatments that are now available.
You know, that's interesting that you mentioned that because, myself as a woman, and I talk to my friends and other family members, and sometimes we'll talk about that. Oh, I don't need to worry about that. There's no family history, but quite the contrary, huh?
Actually, that is correct. The vast majority of women we diagnose in the United States are not considered to be high risk. They have good old-fashioned bad luck.
So there are different guidelines for screening. What does Bronson recommend?
Well, these different guidelines can be really super confusing, but all the guidelines actually agree that annual screening each year, starting at age 40, saves the greatest number of lives. Government statistics show that mammography has helped to reduce breast cancer deaths in the United States by almost 40% since 1990. And that is a really impressive statistic. So the Bronson breast health experts believe the potential risks of a mammogram are really low compared to saving life by finding breast cancer early. And that's why we recommend annual mammograms each year starting at age 40.
How can our listeners make an appointment to get their mammogram done?
It is super easy. If you have seen your primary care provider within the last 3 years, you can schedule your own appointment online at Bronson MyChart, if you have MyChart, or by calling the following number, 888-741-6415.
Well, thank you so much for your time this morning, Dr. Daly. And of course, it is a very important topic. Again, if you want to get that appointment scheduled, you go to Bronson MyChart account. And if you don't have one, you can call 888-741-6415.